I encourage people to scoot their rear end to the end of the exam table. Again, I'd encourage you to use word choices that you would feel comfortable using in front of your grandmother. This is a rear end, all right? You know, different language like that. So go ahead and scooch down to the end. Go ahead and let me help you place your feet into these foot rests. Picture with me, if you will, and half of you will be with me in the exam room, that drape. This is to provide some cover. So if you had it lengthwise like this, like a tablecloth, across their knees, push straight down and push straight back. You can now visualize all of the perineum. Don't forget, your #1 skill is visualization, okay? So you can visualize the perineum and see everything. So what kind of things could you detect just by looking at the perineum? What different things can you identify? Ulcers, great. Lesions, terrific. Normal hair distribution pattern, right? So all these different things are things you can see, maybe herpes, a lesion. If you're with a patient that's over 70, certainly our increased risk for vulvar carcinoma, right? So is there something, an area that you think is a little bit concerned about? So good, remember visualization. Now, in most of the exam rooms, the things I always love about being a student, and it wasn't that long ago, so I do still remember, is like in every room, you're like, where is everything, all right? So in most of the exam rooms, in that top drawer is where you'll find your speculums. Okay, hopefully you'll have a variety of choices. So you open up that speculum drawer, and which speculum do you choose? The one that's closest to you? The littlest one? What kind of things might you want to know about your patient to help guide you in which speculum to choose? If she's ever had a pelvic exam before, good, great question, yeah. I'm a 30-year-old gravida 3, para 3 who's had 3 previous vaginal deliveries. Will that be a different speculum choice than a 69-year-old postmenopausal patient who's been widowed and not sexually active for the last 5 years? Yeah. I'm 17 and been sexually active for a year. Is that a different, and a gravida 0, is that a different speculum than the 30-year-old? Gravida 3, para 3, good. So really, you're not doing any favors by picking the littlest speculum in the drawer, all right? Because if you open and pull out the small speculum, you're gonna place the speculum, open it, you're gonna see a whole lot of vaginal sidewall, and you're just gonna have to remove the speculum, pick a different speculum that's gonna do the job correctly, okay? So you do kind of wanna know those things, all right? Now keep in mind the 30-year-old gravida 3, para 3 who's had 3 previous C-sections, different speculum? Yeah, so again, it's just those good questions, knowing about that patient so you know which is the right tool to get the job done. All right, terrific. So we select the proper speculum. Go ahead and close the drawer here. Of course, I have gloves on my hands. I always tell people you're gonna feel my touch on the inside of your thigh. Okay, this is a firm touch here. Again, guys, keep in mind, right, you're visualizing yourself at the end of the table. Someone puts their hand right on your perineum. You will spend the next 5 minutes talking them back down the exam table, okay? You'll feel my touch on the inside of your thigh. Next, you'll feel my touch on the outside. Again, on the mons pubis, you wanna go ahead and open so that you get a puckering at the base of the introitus so you know where you're placing the speculum. At no point do I think any instrument should be jammed into any orifice for any reason. All right, but certainly we don't want to be jamming into the urethra, all right? So you want to kind of see where you're at. With that speculum, encourage me, because I encourage you to trust me in that I know the textbook says 45-degree angle, back towards the 45, twist. If you've ever had a twist experience, you'll know how strange that feels. And I've had the opportunity to just work with enough pelvic models that it seems to be a little bit more comfortable. If you take that speculum blade just flat like this and place it here with a little downward pressure, and again, watching your language choice here again, I'm going to insert the speculum, you're going to feel a little pressure. I tell women, if there's anything painful about this exam, tell me and we'll stop. You are completely empowered, all right? You'll be amazed at how much people relax when you empower them and that you promise to listen to them. If they tell you to stop, you'll stop. All right, so place that speculum with downward pressure and just advance it straight forward into the vagina. The contour of the vagina will follow. I have yet to meet the 45-degree angled vagina. All right, and I've been doing this for a while. All right, so downward pressure. All right, now you'll open that speculum. The textbook will make you think, right? Twist, open, open, cervix, right? Not so much in real life, right? So go ahead and advance that speculum as far as you can. There's a handle for a reason. Take your finger and put it down on the hook. If you have your fingers between the speculum handle and her bottom, you can't advance the speculum all the way. It's so much easier to advance the speculum until it's flush, open, and pull back and have the cervix drop into view. than to open it prematurely, see vaginal sidewall, and try and move forward. Make sense? Okay, so you want to go ahead and open that speculum. Who's worried about pinching people with the speculum? I was getting a little nervous about you guys who don't raise your hand on that. Everyone should be nervous about pinching somebody with a speculum. Good, okay. If you're going to pinch someone, it's with the clamp to tighten the speculum. Okay? When you take a close look at it, it's not designed very well, and the fold of the thigh gets behind that clamp, so you want to slip your finger back behind there before you tighten that clamp. Okay? So you open up, you see that cervix, it'll pop into view. You want to tighten that screw clamp, and then you'll have with you the different instruments that you need. Usually, if it's appropriate, collecting the pap smear, collecting testing for gonorrhea and chlamydia, perhaps doing a wet mount. Those would be different things that we would do during our pelvic exam. I will tell you, again, keep in mind how important it is to visualize the entire cervix, because in your 30-year-old patient who's had a history of normal pap smears, when is the recommendation that she have that pap smear repeated? When may she come back for cervical cancer screening again? 3 years. 3 years. In my experience here at the Med Center, over 8 years, I've been diagnosed I've been involved in diagnosing cervical cancer twice. I will have you know that both these women had normal, satisfactory pap smears. They had a lesion on their cervix that just didn't look quite right, that we sent for further follow-up. Your visualization of that cervix is huge. It's big. Always trust your instinct. Listen to that little voice inside of you that tells you something's just not right. Okay? It's important. You'll hone that skill. It's important.